So let's talk about how to read an MRI scan. I explain how to read MRIs based on how the spine lies within our body, and this is the model of our spine. So if we're looking at the spine from the side view like this, what we're able to see is the bones and the disc, and then what runs through the center of the spine is the nerves. So this is the model looking at it from a sagittal view, and then this is the spine on the MRI looking at it in the sagittal view or from the side. And what we see are the bones and then the discs, which are in between. You have the spinal canal, which is this space right here, and it looks like white, which is a spinal fluid, and then the gray little lines here, which are the nerves. Now in the lumbar spine, the spinal cord ends way up high, so you'll see these little string-like things, which are the nerves within the spinal canal. The lumbar spine looks a little different than the cervical spine, and so this video is purely explaining just the lower back or the lumbar. So this is the side view, which is also called the sagittal view, and if we were to turn the spine and look at it from the top down, this is called the axial view. So looking at that axial view on the model compared to the MRI scan, this would be the bone area here, and the spinal canal is right here where all the nerves travel. So this is what we see on the MRI is the bones and then where the nerves travel. And as you scroll through an MRI, you can kind of look and see if the nerves are being pinched by anything. And the CSF is the white, and all the gray little dots are the nerves within the spinal canal. So what we see on this patient's MRI is a slightly bulging disc at L4 and L5. On this patient's MRI, we see an actually herniated disc causing spinal stenosis, where this canal is compromised because this disc is bulging. This particular MRI scan shows a bulging disc with some bone spurs back here causing spinal stenosis, or where you see the canal comes down here and then gets compressed or pinched right here. So that's the basics of how we read a lumbar MRI scan, and I hope you guys learned something from it.